Hi guys, welcome back to Code Master Coach, your medical coding tutor. Guys, we're still on this series of the 2024 official ICD-10-CM coding guidelines. I'm going to move all of these to a playlist because I think by today we're up to part 8. So I'll be moving these to a playlist to make them easier to find. So I hope these are helping. They're beneficial to you. Let's get started. We stopped on last week at Chapter 5. Chapter 5 is on the mental, behavioral, and neurodevelopmental disorders. You can find these between categories F01 through F99 of the ICD-10-CM classification. And as usual, I put my purple notes, which means these are Code Master Coach notes. And I say, a trained eye sees what it needs to see. Think about those exclude one notes. Those use additional code notes, etc. Your eyes are now trained as medical coders to see these notes or instructions to you. My second note says, I always tell my students, love your code book and it will love you back with the right answer. I honestly feel like if you would spend time with these classifications, whether it's ICD-10-CM, CPT, and HCPCS classifications, if you'll spend time in those books, get to know those books and learn them, they'll love you back with the right answer. So we stopped at Chapter 5 at A, pain disorders related to psychological factors. Let's go to our guidelines on 5A. And it says, assign code F45.41 for pain that is exclusively related to psychological disorders, as indicated by the exclude one note under category G89. A code from category G89 should not be assigned with code F45.1. Let me show that to you. So at F45.1, it says there's a code at G89, but I've got it put together this way. When you go to pain, main term pain, and you go down here to psychogenic, it leads you to code F45.41. So if I pull out my alphabetic and my tabular and go to F45.41, it's right in this area. It does say pain disorders exclusively related to psychological factors. But let's skip over to G89 and see this note. Oh, it does say that. Look. Exclude one. Pain disorders exclusively related to psychological factors. F45.41 is an exclude one from category G89. That's what this guideline just said. So F45.41 should not, G89 should not be assigned with code F45.41. Code F45.42, pain disorders with related psychological factors, should be used with the code from category G89, pain not elsewhere classified, if there is documentation of a psychological component for a patient with acute or chronic pain. So let's go back. F45.42. Going back up here. F45.42. Pain disorders related psychological factors, and you got a note. Code also associated acute or chronic pain, G89. So the code book, remember I told you your classification will guide you, but you got to know what to look for. And so when I get down here, it says at category G89, code also related psychological factors associated with pain, F45.42. So your book is telling you exactly what to do here. All right, now we're down to B, mental and behavioral disorders due to psychoactive substance use. So now we're on substances. In remission, okay, selection of a code describing in remission For categories F10 through F19, mental and behavioral disorders due to psychoactive substance use requires the provider's clinical judgment and are assigned only on the basis of provider documentation, unless otherwise instructed by the classification. That means unless otherwise instructed by your code book. Mild substance use disorders in early or sustained remission are classified to the appropriate codes for substance abuse in remission, and moderate or severe substance use disorders in early or sustained remission are classified through the appropriate codes for substance dependence in remission. So let's make sure I'm covering everything it says there. In remission, straight from the guidelines. Now, I did make a note. What is the difference between use, abuse, and dependence? If you use a substance in high quantities, can't control your intake, or feel you need them to perform a specific function, such as unwinding or feeling confident, you're likely abusing them. Drug dependence is a physical condition whereby either your body or your mind adapts to using the substance. Someone may use drugs as they are not intended to achieve a goal, staying awake longer, numbing pain, etc. Whereas someone who abuses drugs is looking to elicit certain feelings and fulfill a craving for substance. Dependence is a state of loss of control against drug use due to craving. So you're craving. By the time you get to dependence, you either use it, or you use it improperly and abuse it, or you become dependent on it. So I made a note here that says use can lead to abuse, which can lead to dependence. All right, we're at number 2, psychoactive substance use, abuse, and dependence. Let's look at the guideline. When the provider's documentation refers to use, abuse, and dependence of the key here is the same drug or same substance, whether it's alcohols, opioids, or cannabis. Only one code should be assigned to identify the pattern of use based on the following hierarchy. So, if both use and abuse of the same substance are documented, assign only the code for the abuse. If both abuse and dependence are documented of the same substance, assign only the code for the dependence. If use, abuse, and dependence are all documented for the same substance, assign only the code for the dependence. And if both use and dependence are documented, assign only the code for dependence. So hopefully you saw from this guideline that you always code to the highest level. So it goes from use to abuse to dependence. And if they ever use any of these in combination for the same substance, then you go with the highest one. All right, that leads us to number 3, psychoactive substance use unspecified. As with all other unspecified diagnoses, the codes for unspecified psychoactive substance use should only be assigned based on provider documentation and when they meet the definition of a reportable diagnosis. These codes are to be used only when the psychoactive substance use is associated with a substance-related disorder or a medical condition, and such a relationship, again, is documented by the provider. So number 3 comes straight from the guideline. Let's go to number 4, medical conditions due to psychoactive substance use, abuse, and dependence. Medical conditions due to substance use, abuse, and dependence are not classified as substance-induced disorders. Let me say that again. Medical conditions due to substance use, abuse, and dependence are not classified as substance-induced disorders. Assign the diagnosis code for the medical condition as directed by the alphabetic index, along with the appropriate psychoactive substance use, abuse, or dependence code. For example, for alcoholic pancreatitis due to alcohol dependence, assign the appropriate code from subcategory K85.2, alcohol-induced acute pancreatitis, and the appropriate code from subcategory F10.2, such as F10.20, for alcohol dependence uncomplicated. It would not be appropriate to assign code F10.288, alcohol dependence with other alcohol-induced disorder. All right, let's go to number 5, blood alcohol levels. A code from category Y90, evidence of alcohol involvement determined by blood alcohol level, may be assigned when this information is documented and the patient's provider has documented a condition classifiable to category F10, alcohol-related disorders. The blood alcohol level does not need to be documented by the patient's provider in order for it to be coded. So let's look at what I have. At number 5, I put a note here, and I should have had that in purple for Codemaster Coach, that says external cause of injury index to find for these blood alcohol levels. So when I'm in the, right here, ICD-10-CM index to external cause of index, of injuries, ICD-10-CM index to external causes of injuries index, not the alphabetic index to disease and injuries, but I'm in the external cause. We're going to go down to blood alcohol level right here. And you find the blood alcohol level, 20 to 39, there's your codes. These are your codes right here. But again, you find these in the external cause of injury index. All right, and another thing I always say is with these blood alcohol levels, if I find it documented anywhere in the chart, then I'll go ahead and code it. But again, it says here, if it is not documented what the blood alcohol level is, you don't necessarily have to have blood alcohol level if the physician diagnosed the patient with an alcohol condition. But if it's documented, if the blood alcohol level is actually documented, I code it. All right, we're down to C, fictitious disorders. Fictitious disorders imposed on self or Munchausen syndrome is a disorder in which a person falsely reports or causes his or her own physical or psychological signs or symptoms. For patients with documented fictitious disorders on self or Munchausen syndrome, assign the appropriate code from subcategory F68.1, fictitious disorder imposed on self. Now, Munchausen syndrome by proxy, they call that MSBP, is a disorder in which a caregiver, we consider them perpetrators, falsely reports or causes an illness or injury in another person that makes them the victim under his or her care, such as a child, an elderly adult, or a person who has a disability. The condition is also referred to as, again, fictitious disorder imposed on another or fictitious disorder by proxy. The perpetrator, not the victim, receives this diagnosis. And you'd assign code F68A, fictitious disorder imposed on another, to the perpetrator's record. For the victim of a patient suffering from MSBP, assign the appropriate code from categories T74, adult and child abuse, neglect, and other maltreatment, confirmed, or T76, adult and child abuse, neglect, or other maltreatment, suspected. All right, let's go back to our guidelines. And I just made a note that Munchausen syndrome, also known as fictitious disorder, is a rare type of mental disorder in which a person fakes illnesses. The person may lie about symptoms, make themselves appear sick, or make themselves purposely unwell. All right, and we're down to dementia. Let's look at what dementia says. ICD-10-CM classifies dementia, F01, F02, and F03, on the basis of the etiology, which means the cause, like Alzheimer's, and the severity, whether it's unspecified, mild, moderate, or severe. And selection of the appropriate severity level requires the provider's clinical judgment, and codes should be assigned only on the basis of provider documentation, unless otherwise instructed by the classification, unless your code book with your trained eye tells you differently. If the documentation does not provide information about the severity of the dementia, assign the appropriate code for unspecified severity. It wasn't given to you, don't specify it. If a patient is admitted to an inpatient acute care hospital or other inpatient facility setting with dementia at one severity level and it progresses to a higher severity level, then assign one code for the highest severity level reported during the stay. Okay, guys, that leads us to Chapter 6, which is on diseases of the nervous system G00 through G99, which we will cover on next week. All right, guys, thanks for following along with me. I hope this is helping you as you're studying, and I will see you next week.